Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering hematology and the important concepts to know for NCLEX, HESI, ATI, any quizzes, midterms, finals that you're taking for hematology. I've pulled out the most important concepts. I know I'm not going to be able to get through all of them, so this is definitely going to be a part 2 series. Make sure you watch both. If you like my videos so far, guys, and you want them to keep coming, please be sure to press that subscribe button and you'll get a notification as soon as I post a new video. If you like the video, make sure you like it. And of course, put in a comment if there's any content that you want to see that I haven't covered yet. Okay, so on this video, we're doing hematology. Let's just jump right into it. First question. A 43-year-old African-American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? A, body temperature of 99 degrees or less. B, toes moved in an active range of motion. C, sensation reported when the soles of feet are touched. Or D, capillary refill of less than 3 seconds. And the correct answer, guys, is D, capillary refill of less than 3 seconds. That's what lets you know the patient's getting good circulation, right? If you press down and you blanch and then it takes less than 3 seconds for it to turn pink again, that means the patient has good circulation. The reason it's turning pink is that blood that's returning back to the area that's giving that pink reddish color, okay? So you want to see capillary refill less than 3 seconds. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? A, side lying with the knees flexed. B, knee chest. C, high followers with the knees flexed. Or D, semi-followers with legs extended on the bed. And the correct answer is D, guys. Semi-followers with the legs extended on the bed. Did you guys notice that A, B, and C all had something in common? They were wrong, by the way, but all three have that patient flexing something. I want you to think about this. You can't see my lower extremity, but you can see my upper, right? So if I'm flexing my arms, what do you think is happening to the vessel? It's being squeezed. How's blood supposed to get through, right? So you don't want to flex anything where you're making it harder for blood to flow, right? So A, B, and C are absolutely wrong. You want the patient semi-followers with the leg extended, all right? You don't want to create any difficulties for blood flow or circulation. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? A, taking hourly blood pressures with medical cuff. 2, encouraging fluid intake of at least 200 mLs per hour. C, position in high followers with knee gats raised. Or D, administering Tylenol as ordered. And the correct answer is B, as I said in my previous video in regards to sickle cell, right? Patient comes in sickle cell crisis. One of your biggest priority is giving fluids. Why? One of the biggest triggers for crisis is dehydration. That's why we teach these patients to stay hydrated, walk around with a water bottle, stay away from hot environments, stay away, when I say hot environments, so they don't sweat. They sweat, what happens? They get dehydrated. If they're going to hot environments, make sure they keep themselves hydrated, right? Also the opposite, we tell them we want them to stay away from very high areas. And I'll get into that with you in a moment. But for this particular question, you want them to increase fluids. Why? Because the minute you start increasing those fluids, those RBCs that were taking the half moon shape, that sickle shape, all of a sudden they bloop, 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 bloop. They pop from the, pop isn't a word I should use. They expand. That's the word I'm looking for. They expand from the sickle shape to a nice round shape, because remember, when those RBCs are sickled, you think they're going to be able to get through those vessels? No, they all start to clump up, right? But the minute you hydrate them, you give them fluids, those sickled shape turn into nice round discoid shape and circulation improves. Guess what? If circulation of the RBC improves, hemoglobin improves, because remember, hemoglobin is carried in what? The RBCs. So it only makes sense. So that's your correct answer. You want to give them fluids that will help increase circulation. Look at your other choices. Choice A was the blood pressure cuff. What do you think the blood pressure cuff does? It squeezes. Didn't I just tell you want circulation when the patient has sickle cell? You don't want anything squeezing the vessels. That's why you're not doing anything in the flex position, because you're squeezing the vessels. So no, you're going to stay away from that. Choice C. Elevate the knee gauge. Did I not just tell you that you don't flex anything? So we know that's not a choice. And then you have D, give them Tylenol. Now, for my students that I've taught in the classroom, you already know what I've told you about sickle cell. Let's go back to what I've told you about pain. Pain never killed anyone, right? In most instances. But there are few instances that pain is so bad, physiologically, it can place that patient in danger. And what are those conditions? Burns, sickle cell crisis, and stones. Okay? However, look at what D says, Tylenol. If I just told you that sickle cell crisis is one of those pains that can throw a patient into physiological danger, you think Tylenol is going to do anything for them? Absolutely not. If a patient's in sickle cell crisis, they're going to need narcotics like morphine. Tylenol is not going to do anything for that patient. Okay? And they try to trick you because they wanted you to say to yourself, well, whoa, I know pain is one of the worst with sickle cell. Let me give the patient an analgesic, not a Tylenol. That's not going to touch the patient. And even if it did, the first thing we're going to do is give that patient fluids. After we give them fluids, then we're going to move on and give them pain medication. We're going to give them oxygen, all that good stuff. But don't be tricked also. Don't be tricked into the answer of giving oxygen first. Remember, the problem isn't really them not getting oxygen. The oxygen is in the hemoglobin. The problem is that the hemoglobin is now in a sickled shape and it can't travel through. It can't get to where it needs to go. But the minute you give that patient fluids, the RBC takes a discoid shape, and now that hemoglobin is moving freely again, okay? Next question. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? A, steak. B, cottage cheese. C, popsicle. Or D, lima beans. And I hope you guys chose C as in popsicle, because did I not just ram it down your throat telling you the patient needs fluids, 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 fluids? So you're going to give them a popsicle because that increases their fluids. Next question. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? A, roast beef, gelatin, green beans, and peach pie. B, chicken salad sandwich, coleslaw, french fries, ice cream. C, egg salad on wheat, carrot sticks, lettuce salad, raisin pie. Or D, pork chop, cream potatoes, corn, and coconut cake. And the correct answer is C, guys. And here's how they try to trick you. All of these choices have something in there that's high in iron. However, C has the most choices that are high in iron, okay? Egg salad. What's high in iron in that? The egg yolk. Wheat bread, that's high in iron. Carrot, that's high in iron. Lettuce, green leafy vegetables, that's high in iron. And of course, raisin pie, the raisin is high in iron. Let's look at our other choices. For choice A, the only thing there that's high in iron is the roast beef. For choice B, the only thing that's high in iron is the coleslaw. And let me be more specific. The reason coleslaw is because coleslaw, you know, it's made of cabbage, it's made of carrots. I'm not American, I'm Haitian, so I don't know too much about coleslaw. I don't know what else people put in coleslaw, but I know there's cabbage and carrots. I don't know what else is in there. But Anyway, in coleslaw, the cabbage portion is high in iron, okay? And in choice D, the only thing that's high in iron is the pork chops. So by far, choice C is your correct answer because choice C, everything in there is high in iron. Next question. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A, a family vacation in the Rocky Mountains. B, chaperoning the local boys club on a snow skiing trip. C, traveling by airplane for business trips. Or D, a bus trip to the Museum of Natural History. And the correct answer is D. That's the only choice that is correct. Do you guys notice something in common with A, B, and C? A, B, and C all include high altitudes. That patients with sickle cell anemia, we don't want them to go in anywhere with high altitudes. So the correct answer is choice D. We're keeping them nice on the ground. Hopefully there's AC so they're not sweating. And hopefully they have a water bottle so they can stay hydrated. Next question. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? A, enlarged spleen. B, elevated blood pressure. C, bradycardia. Or D, beefy tongue. And the correct answer is D, beefy tongue. When you see a patient with pernicious anemia, by the way, when you see pernicious anemia, that's what it is, a vitamin B12 deficiency. When a patient has pernicious anemia, one of those signs and symptoms is a red, beefy tongue. So D is the correct answer. A nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? A, a blood pressure of 146/88. B, respirations of 28 and shallow. C, weight gain of 10 pounds in 6 months. Or D, pink complexion. And the correct answer is B, the respirations of 28 and shallow. Think about what's happening here, guys. If the patient is anemic, their hemoglobin's down. Remember what's in the hemoglobin? Oxygen, right? Oxygen is carried in the hemoglobin. So if the hemoglobin is down, the patient's oxygen is down. So duh, their respirations are going to be up. They're trying to breathe. They're trying to get more oxygen. So instead of their respirations being 12 to 22, you're going to see it increase because they do not have enough oxygen. When you think of anemia, I want you to think of decreased hemoglobin, which means decreased oxygen. So yes, their respirations are going to increase. They're going to be like, why? They're trying to get oxygen that they don't have. Okay, let's look at our other choices. A, blood pressure of 146/88. I want you to think about this. If the hemoglobin's down, what's the hemoglobin carried in? RBC. So obviously the RBCs are down as well, right? So the blood pressure is not going to be up. The blood pressure is going to be down. So one can't be the correct answer. Choice 3, weight gain of 10 pounds. No, the patient's going to lose weight. They're going to be losing weight if they're anemic. And then choice D, pink complexion. You want to know what gives patients the nice pink complexion? Blood flow, specifically RBCs. But guess what? The RBC's down. The hemoglobin's down. The oxygen is down. So in anemia, that patient's not going to be pink. They're going to be pale colored. Okay? Next question. The nurse is teaching the client with I can never pronounce this, guys. Polycythemia vera about the prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? A, I will drink 500 milliliters of fluid or less each day. B, I will wear support hose. C, I will check my blood pressure regularly. Or D, I will report ankle edema. I'll give you a moment to think of your answer. Okay, guys, so the correct answer is A. I will drink 500 mLs of fluid or less each day. Now, this question, whenever, remember I told you, whenever you see a question saying which one needs further teaching or which one needs clarification, really what they're asking you, which one is the wrong answer? And in this situation, A is the wrong answer. Wearing a support hose, checking blood pressure, reporting edema, all of those are right answers. Now, what they're talking about here in this question is Polycythemia vera, and that is where that patient is making way too many RBCs. Remember, those blood cells are all produced where? In the bone marrow, okay? So they're making way too many RBCs. And usually with Polycythemia vera, not always, but usually, along with those increased RBCs, come the increased WBCs, the increased platelets, right? So the patient has bone pain. The reason they're having bone pain is because they have all of these extra cells that are growing in that bone that should not be, okay? So the patient has bone pain, all these extra RBCs, WBCs, and platelets. What does that put the patient at risk for? Clot, a thrombus, DVT. That DVT starts traveling, turns into what? An embolism, okay? So what does that patient need to do? That patient needs to be drinking lots of fluids. What we can't afford is for that patient to get a clot, okay? So number one is wrong. They need to be drinking lots of fluid. Everything else, 2, 3, and 4 are correct. B, I need to wear support hose. Absolutely. We want to make sure that circulation stays intact. That patient's going to be wearing support hose because what happens to blood when it doesn't move? It starts to clot, right? This patient's already at risk for clots because of the increased platelets. So yes, we want them to wear support hose. C, I'll check my blood pressure regularly. Absolutely, because they have all these extra blood cell products that are being produced. What is high blood pressure? High blood pressure is just the pressure that's exerted against the vessels. So guess what? More blood cells, that's more pressure being exerted against the vessels, which means increased blood pressure. Blood pressure gets so high, patient might have a stroke. So yes, they're going to check their blood pressure regularly. And D, I will report ankle edema. Absolutely. What does ankle edema tell you? Circulation's gone down. That blood's not flowing back to the heart. Blood doesn't flow. It does what? It pools. Blood starts to pool. Blood does what? Coagulate. Bam. Patient's got a clot. Okay? Next question. A 33-year-old male is being evaluated for acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? A, client collects stamps as a hobby. B, client recently lost his job as a postal worker. C, client had radiation for treatment of Hodgkin's disease as a teenager. D, the client's brother had leukemia as a child. And I'll give you a moment to think of your answer. Correct answer is C. Excuse me. The client had radiation for treatment of Hodgkin's disease as a teenager. So what is leukemia? Remember, leukemia is a cancer that attacks those blood cell making tissues. Where did I just tell you those blood cells are formed in? The bone marrow. So once that bone marrow is attacked, that patient's not making WBCs like they're supposed to, so that puts the patient at risk for infection. That patient's not making platelets like they're supposed to, that puts the patient at risk for bleeding, right? That patient's not making RBCs like they're supposed to, that puts the patient at risk for anemia, okay? So the reason C is the answer, if that patient had radiation before for another disease process, what does radiation do? Radiation kills the bad cells, but it also kills the good cells. So here this patient had Hodgkin's, is it lymphoma? Hodgkin's disease. Patient had Hodgkin's disease. They were getting radiation to kill those cancer cells, but at the same time, radiation doesn't distinguish between the good cells and the bad cells. It's killing the cells. So in this instance, it's also killed the good cells, which were those tissues that help make the blood products, okay? And by the way, I know some of you guys were thinking D was the answer because high risk factor for cancer is always if you have a family member. Here is why C is more of a risk factor, because they actually got something that was killing their cells. Okay, so yes, having a family member, a brother, yes, that's a risk factor, but it's not as high as a risk factor as somebody who's previously gone through radiation. The client's being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? A, have you noticed a change in sleeping habits? B, have you had a respiratory infection in the last 6 months? C, have you lost weight recently? Or D, have you noticed changes in your alertness? And I'll give you a moment to think of your answer, but I really shouldn't give you a moment because I gave you this answer about 2 questions ago when I was giving you a rationale for something else. So the correct answer is B, have you had a respiratory infection in the last 6 months? Remember, I was telling you one of those things about leukemia. Remember that leukemia is a cancer that attacks those blood cell making tissues, such as the bone marrow, right? So everything's down. WBC down, platelet down, RBC's down. Leukemia, leukocytes type of what? WBC down puts a patient at risk for what? Infection. So you're going to ask the patient, have you had a respiratory infection in the last 6 months? These type of patients, their immune system's down. They can't fight infection like the normal layperson would be able to. Next question. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? A, oral mucous membrane altered related to chemotherapy. B, risk for injury related to thrombocytopenia. C, fatigue related to disease process. Or D, interrupted family process related to life-threatening illness of a family member. And I also gave you this answer already as well. So the answer is B, risk for injury related to thrombocytopenia. What is thrombocytopenia? Well, break that word down. Thrombus, that's a blood clot. Cytopenia, penia, little bit of blood clots. Why? Remember I told you leukemia, WBC down, RBC down. What else? Platelet down. So the patient's at risk for what? Bleeding. If they could bump into a coffee table and bleed to death, have internal hemorrhage, because the platelets is what helps you clot so you don't bleed out. But these patients' platelets are exceedingly low, to the point that any tiny little injury can cause life-threatening situation, okay? So that's that. Out of this list that's given to us by far, that is the biggest risk, and that's going to be our priority diagnosis. Next question. A client has an autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor A, platelet count, B, white blood cell count, C, potassium levels, or D, partial prothrombin time. And the correct answer is A, platelet count. I just broke that word down for you guys. Thrombus, blood clot, cytopenic, just a little bit of blood clots. What makes your blood clot? Platelets. So obviously you're going to look at the platelet count, okay? That's, by the way, patient has thrombocytopenia purpura, they're at risk for bleeding. All right, guys, last question. A home health nurse is visiting a client with autoimmune thrombocytopenic purpura. The client's platelet count is currently 80,000. It would be most important to teach the client and family about A, bleeding precaution, B, prevention of falls, C, oxygen therapy, or D, conservation of energy. And by now, I'm pretty sure that you guys all got this answer correctly. The correct answer is A, bleeding precautions, guys. Your platelet. Your platelet count should be about 120,000 to 400,000, right? And in the question, this patient's platelet count is only 80,000. So you know that patient's at risk for bleeding. So number one priority is bleeding precautions. Now on this list, right after bleeding precaution is going to be prevention of falls, because if they fall, there's a high chance they're going to what? Bleed, even internal bleeding, right? But whenever we're talking about decreased platelet, we're worried about patient bleeding to death. And so we're worried about them not clotting. And so we're going to be teaching them about bleeding precautions. Guys, I hope you guys found this video to be helpful. There is going to be a part 2 on hematology coming very soon, because there's a lot more. I might even do a part 3 because there's a lot more in hematology besides sickle cell, thrombocytopenia, and iron deficiency anemia. Okay, and even the iron deficiency anemia, there's some very important concepts that you guys absolutely must know that I did not have on this list. So I got to go find them, and I'll make sure I cover them for you. Guys, please, you guys want to see those videos coming? I need the encouragement. So go ahead, like my video, subscribe to my channel, so every time I post a new video, you'll know as soon as I post it. And of course, leave me a comment if there are any concepts or subjects that you'd like me to see me do a video on. Thank you so much for joining me, and I'll see you next time.